Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, minor emergencies can mean long wait times in the ER. We'll direct you to the express line. Crazy about cars? We'll go back to the drawing board to see how designers said they ought to be made. Then we'll brush up on ways to keep your smile sunny all summer long. Plus, a spirited discussion on finding uplifting activities. And how to combine veterans and Medicaid benefits to provide the best possible care for a loved one.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. You gave yourself a pretty deep cut. Does it need stitches? You twisted your ankle. Should you head to the ER? When you have an urgent medical need, but it's not a life-threatening emergency, where can you go? Dr. Julia Bruner is here to map it out for you. Dr. Bruner is the director of Metro Express Care at Metro Health. So welcome to the show.
Thank you.
Express Care sounds fast, but can you slow it down for a minute and tell us exactly what that means? How does it work?
Express Care is a clinic that's available to patients that have the opportunity to be seen for an urgent issue that their primary care doc can't fit them in for, and they don't want to go to the emergency department for. They don't need to go to the emergency department for it.
Okay, so it's like walk-in care so that you're not bleeding to death or anything, but you need somebody to look at something right away.
Correct.
Okay, so some of us have a hard time rating what our actual emergency is. You know, I have a drama queen daughter who thinks everything is an emergency. So how do we know when we go to Express Care or when we should go to the ER or call 911?
If you have a life-threatening medical emergency or there's a significant disability with what's going on with your current health issue, then we ask that you go to the emergency department for those things and call 911.
Okay, so these are some of the examples?
So things such as you're bleeding and you can't stop bleeding, or you have severe chest pain, or you're having signs of a stroke, or your child has swallowed a bottle of detergent from underneath the sink. Those are things that you would go to the emergency department for rather than coming to see us.
Okay, so then what is Express Care actually for?
We are meant to fill most of the things that we all have to deal with on a regular day-to-day basis. So if you have a persistent sinus problem that's bothering you, if you accidentally burn yourself with some hot liquid on the stove, but it's not that bad, if you sprain your ankle and you're worried, did I break it or did I sprain it? If you are having signs of a rash and you're not quite for sure what the cause is. Things that your doc would normally handle, but they're just not able to get you in to take care of it when you want them to do it.
Okay, so what if we're evaluating our situation, but we're still really not sure which way to go? Any help for that? Sure.
There's the Metro Health line is used throughout the city very regularly, and that's that phone number is 216-778-7878. And you can call and ask them for advice, and they can direct you to the right place. And if you happen to come in to see us without calling first, if we find that your health condition warrants going to the emergency department, we'll advise you that, and we'll help you get there if we need to.
Oh, that's good. Good help with the transportation as well. Now, if you're going to go to an Express Care site, who are you actually seeing? Who are the treating individuals there?
We have a staff of nurses that first meet you when you get there, and then we've got physicians and nurse practitioners and physician assistants that will see you.
Okay, and how about what kind of doctors are they? Are they actually emergency room doctors? Are they primary care doctors?
No, all of us are trained in primary care medicine, and that's part of the beauty of Express Care. Our intent is to make sure that you maintain a connection with your primary care doc.
Okay, so you should probably call your doctor anyway.
You should.
After things have settled down and just to make sure everything's going all right.
Right.
Okay. Now, if we're going to the ER, I've experienced it, you're sitting there and waiting for a very long time because there's people there who are maybe way worse than what you are. So if we're going to go to Express Care, is it faster? Is it just better? What's the benefits there?
The Express Care is built to have managed low acute urgent issues. So you're not going to be held up with somebody in general who comes in with acute chest pain. When those patients do come in, we usually get them transportation to the emergency department pretty quickly. So the docs aren't going to be tied up dealing with severe illnesses. So we're dealing with the issue that you have at hand, and then we have you go back to see your regular doc.
Okay, well, it sounds good. Sounds like a good plan if you aren't sure or you don't really need the ER. If you can't wait for a doctor's appointment, but you don't need the emergency room, get in the fast lane by visiting Metro Health's Express Care. To find out more, use the information that's coming up next. My thanks to Dr. Bruner for expressing so well the value of Express Care.
Thank you.
Find out more about Metro Health's Express Care by calling 216-957-1680 or visit www.metrohealth.org/expresscare. Next, car designs that got the green light.